Well, good afternoon, everybody. And it's once again great to be out of our State Operations Center and out in the community up here in Northern California in Napa County at Mustard's Restaurant. We are here to update you, as we do on a daily basis, as it relates to the current status of those hospitalized, those in ICUs, number of deaths, and the like related to COVID-19, but also to make some announcements in relationship to some additional modifications to our stay-at-home order. We have 24 counties currently in the state of California that have self-attested, certified with containment plans, with protection plans that we have put online. They were able to self-attest on the basis of a number of factors that were unique to their county and their region. It was a recognition in California that's larger in population than 21 states combined, that one size does not fit all. None of us naive about that. We recognize the conditions across the state are unique and distinctive depending where you are across the state. And as a consequence, the modifications that we made statewide, we allowed for further modification into what we refer to as Stage 2 in these 24 counties. We have been working very collaboratively and very closely with their health directors, and we have put those self-attestations up online at our covid19.ca.gov website, and we have allowed through technology, mapping technology, the simple ability for you and others not only living in the community but even outside the committee to check in to see how those counties are doing against their commitments, against their self-certification in terms of their capacity to test, to trace, to track, to isolate, to provide protection for the most vulnerable in their community, be it skilled nursing facilities, other congregate facilities, their capacity to deal with hospital surge, and the like. We've been tracking over the course of the last 14 days by seeing a decline in hospitalizations by 7.5%, 7.5% decline over a 14-day period in hospitalization statewide. We have seen an 8.7% decline in the number of ICU patients over a 14-day period. The last few weeks, we've also seen an unprecedented number of masks be distributed, PPE, throughout the state of California. Tens of millions of masks now we've been able to distribute just in the last number of weeks since we've now moved into this next phase, phase 2 of our stay-at-home order. All of these things matter. The PPE is foundational to furthering our efforts to make meaningful modifications to the stay-at-home order. The PPE is coming in, and it's coming in, and it's going out as quickly as we can get it out. And it's going out into critical sectors of our economy. We also are significantly advancing the cause of increasing our testing capacity in the state of California. 1.3 million tests have been conducted to date in the state of California. 57,000 tests just in the last 24 hours were conducted in the state. We're making real progress on our testing as well. We have a very sophisticated tracing core that is well established in the state of California. In every county in this state, going back decades, we have health departments that have professional trained tracers and trackers that deal with infectious disease spread from HIV and AIDS to measles, TB, and the like. We had a workforce of a little over 2,800 that were already trained at the local level, a robust workforce in that space. We now have been able to train an additional 500 through our partnership with UCSF and UCLA, but that cohort now is being replaced with an additional 300 that are entering into that training. So we're seeing that increase in terms of the capacity to have more tracers and trackers. We're seeing that happen in real time, and we're seeing the spread of that capacity in a very meaningful way. Testing is improving, tracing we are training and deploying our tracers. We're getting PPE up, and we're getting it out, and we are seeing a significant, steady rate of decline over a long period of time in the number of people hospitalized in our ICUs. We are moving forward to allow some of the larger counties to continue to make progress deeper into phase 2, and to do so effective immediately, but on their own pace. And I say effective immediately, meaning the guidelines are out there, meaning the processes are in place, but they can go at their own pace. We estimate roughly, plus or minus, again, it's a dynamic number, roughly 53 of the 58 counties would be eligible to move into this phase. Again, not everyone will move into this phase, and that eligibility is conditioned on the criteria. The criteria, though, is foundational in this respect, that we're really starting to focus in on the hot spots within counties, particularly in and around our skilled nursing facilities, and those areas within the counties that remain the most vulnerable and challenging in terms of protecting people and protecting the spread of this virus. So we, in this next phase, are looking to redouble the efforts around those hotspots within those counties. As well, we are looking to advance some guidelines related to total hospitalizations, no greater than 5% increase over a 7-day period, and make sure that the tracing capacity is adequate to meet at least needs of 15 tracers per 100,000 population. Continue to make sure that the positivity rate, and this is a rate that I've brought up on a few occasions in the past, tracks at less than 8%. And what I mean, if you haven't been following the reference to positivity rates, that's the simple percentage of people we're testing that are tested positive. And so that rate is now spelled out in the attestations as we move forward as a rate that we are tracking. So that's the framework today, encouraging progress as we move forward deeper into phase 2 in the state. And I should just note that we are also looking forward in the next few weeks at a number of significant milestones that are worthy of highlighting. We expect, if we hold the rate of transmissions, we hold the positivity rate down, we continue to do justice to the hospitalization and ICU numbers, that we'll be making announcements statewide, not just with the regional variances, that would allow for retail not just to be picked up, but in-store retail to be loosened up. In addition to that, sporting events, pro sports, in that first week or so of June without spectators and modifications and very prescriptive conditions also can begin to move forward, and a number of other sectors of our economy will open up again if we hold these trend lines in the next number of weeks. And that includes, for example, getting a haircut, which is very meaningful. And that can be done on a regional variance, but it will be able to be advanced, we believe, in the next few weeks, even statewide. And so I want to just go back to that because I know it's an important one, the hair issues for some, and getting a haircut. The regional variances that we're announcing today will allow for modifications in that space. Statewide, we see if these trend lines hold within a couple weeks to broaden with meaningful modification that particular guideline and order statewide. So